Yeah. Please keep reading. Enjoy your meals, and I won't ask you to speak while you're chewing. I'll try. I want to first thank you all for coming very much. So when I first, 100,000 years ago, I was an assistant professor at Texas State, and I loved it here. And unfortunately, I ended up having to leave because of my husband's job. And so I wanted to come back. And when I came back in 2012, the first thing that I was fortunate to do was somebody invited me to go to a lunch meeting that was hosted by the Center for Children and Families, Dr. Nancy Chavkin. And it was so wonderful to get to be in a room with people that were doing work that was similar to my own, that had a passion for research like I do, and programming and working with community partners, and finding that tribe early for me was a game changer. And the world changed, we've had some things happen, and that center, Dr. Chavkin retired, and we had COVID, et cetera, but we've been dying to resurrect this because I think it's really important. So we are committing to hosting these on a regular basis, and they will remain informal, and they will remain lunch provided, and they will hopefully be a forum where we can have more conversations informally and network with each other about research, because I really love it when we get to do this, and I think it has so much secret potential, unmeasured perhaps, but it's just organic and it happens and it's awesome. So thank you for coming to take part in that. I think I know most of you. I'm Melinda Villagran, and I direct the Translational Health Research Center. I'm not going to go into a big spiel about much, but here's what I want to tell you. This year we launched formally a faculty fellows program. And this faculty fellows program this year has 9 fellows, including 2 that you're going to hear from today. The great thing about the faculty fellows is, like everybody else at Texas State, they're really successful and they're really busy. So guess what? They do very similar work, these 2 that are going to speak today. Very, very different, but also very, very similar. And they didn't know each other until we had our initial meeting of the faculty fellows. And so again, this idea of our center being a convener of people and bringing people together who can do amazing things, either on their own or just support each other separately. They speak each other's language. They both, they use blood samples, whatever. Great. So these things matter. And I'm so grateful to have both of our speakers today. The last thing I want to do really quickly is introduce some VIPs in my book. First, we have our Chief Research Officer at Texas State University, the Associate Vice President for Research and Sponsored Programs. Do you say that Shri?
Please call me Shri.
Shri. So again, first year here, total A team, super lucky. Things are moving in the right direction, and we get to be a part of it. So we want to do our best to help elevate and amplify everything that you do in your centers, in your departments, and in your research. The other A team members in the room, I got them in. Ron Everson, advancement, major collaborator, champion of business partnerships for Texas State that can be leveraged again for research. In the back of the room have Evie, Olga, Reddy, all from ORSP. As you all know, Evie is, forever and ever. She is everyone's friend and knows how to do everything related to research development. Olga is working with her now, and Reddy works on commercialization and tech transfer. Very important stuff for our research mission. But the last thing I want to mention quickly, I forgot, over in the corner, Rodney Roddy. Yeah, Rodney Roddy, Associate Director of Translational Health Research Center, helps a lot with promoting faculty stuff on social media. So if you have great publications, great presentations, great whatever, he's got a massive following and he's on social media, and he does a really beautiful job in helping to amplify other people's work, and I really appreciate that. So Rodney, but again, the real VIPs that do all the work, I got to mention them. So over here, Shadi. Dr. Shadi Maleki is a THRC staff member. She has a PhD in GIS, Information Sciences, but she's bringing her GIS hat to the topic of health and resiliency to layer on data samples and bring together things in maps so we can understand things like social determinants of health, not just the data itself, but where it happens, because that matters. and how it happens in people's lives. That matters. And so we're grateful to have Shadi join us. Jessica Snyder. Many of you probably know Jessica Snyder. She's been here in various roles. I've totally scored. Brought her to THRC. She is director of our resilience research programs, and also most specifically for today, faculty fellows. And so she supports all of the faculty fellow research and programs. Abby Mott worked at the original. Remember that started with the story? Abby was the one that put the events together for Dr. Chapkin. You know, one of the smart things I've done in my life was to say, hey, can we bring you over here? And so she has been running events and operations for us and does our scholar showcase beautifully. In the back, Emily Valentine, Catherine Peterman, communications and marketing, and our admin. So this is a THRC staff that serves you. We are here to help elevate research, to do community partnerships, to do research that matters in our goal to R1, and also in our efforts to bring together people on campus that are struggling because we're all so busy. But when you work together, a lot of times it can become unmanageable. I actually forgot one person. Our newest staff member in the back is not that new, Marsha Bernie. You may have known Marsha. She's been here before. She used to work in THRC. 3.5 years ago, she went off to some business career, whatever. We rubbed her back and she's on to HC, so we're thrilled. She's our director of community partnerships. And so that will be a very important role for us as well. So that's a lot. I know. I want to let the real stars get started. I think our first speaker is Matt McAllister. And Matt and Jacky Zhu are both going to talk for about 15 to 20 minutes max, and then we're going to have a little bit of Q&A with them. So if you will hold your questions while they're speaking, they're going to give you kind of just, I mean, you know, they're researchers, so they can talk for 6 hours about their research, but they love it. So we've really kind of challenged them to be a little bit short so that we can have some dialogue about what they do. So this is not their full research program, it's just the tip of the iceberg, but it will give you a flavor of the types of excellent work that they do. So Matt.
Thank you for the introduction. Thanks everyone for coming. This is actually my first in-person research talk since COVID, so it's actually really exciting to do this in person. And thanks to THRC and all that were involved in getting this set up. I'm excited to be here. So I'm Matt McAllister. I'm an associate professor and the director of the Metabolic and Applied Physiology Lab in Health and Human Performance. You know, when I was thinking of the topic of discussion today and putting together the slides, the topic being maintaining health and immunity post-COVID-19 pandemic, I can't help but recognize and acknowledge how stressful the pandemic was on everyone. And the thing with stress is everyone can relate to feeling stressed, especially working in academia, because we work in this environment where we've always got something to do. We're always busy. There's always emails to respond to. There's always papers to publish. There's always grants to submit. There's always committee work, meetings, etc. It's nonstop and never ending, right? And I think when most people think about stress and the impact of stress on the body, they're thinking about these types of things. A lot of times, psychological stressors, financial issues, relationship issues, those types of things. When I think of stress, I think of not only the psychological or cognitive stress, but also environmental stress, things like exposure to high humidity, high temperature environments, smoke, chemical, air pollution. I also think about metabolic stressors like obesity and poor dietary habits, also physiological stressors, intense physical exertion, those types of things. Or you might have a scenario where you're exposed to multiple stressors of different origins. And you have these concurrent stressors, which really gives you a pretty exacerbated response in the body. So what we're doing in our lab is we are identifying the impact of those stressors on the body by studying biomarkers of stress, both traditional and non-traditional biomarkers of stress, which I'll talk briefly about today. Primarily what we're doing is we're looking at biomarkers of stress in blood and saliva, and we're studying interventions that can be utilized to mitigate the impact of some of these stressors. Because of that, the primary populations we're focused on working with are high stress tactical occupations, military, law enforcement, firefighters. These individuals are exposed to, on a regular basis, a variety of, again, environmental, psychological, metabolic stressors that, yes, collectively will adversely affect occupational performance. but when you're exposed to them on a regular basis, can also increase your risk for developing several chronic diseases. In the last 5 to 10 years, the overwhelming majority of my work, our work in our lab, has been focused on firefighters. And I think when you think of a firefighter and the stress, the factors they're exposed to, I think most people think of something like this. What do you picture when you think of a firefighter? You think of, the added mass, because they're going in, they're responding to a structural fire, so they have all this extra gear they have to wear, the PPE, the protective equipment, the air tank or the FCBA, the breathing apparatus, the added mass of the force entry tools that they're wearing or the hose that they're carrying. All those factors add physical stress because of the added physical exertion from the extra mass. But then you think about, okay, so they're responding to a structural fire. And okay, so they have the added stressor of the heat and the environmental stressors there. But a lot of the calls in this occupation aren't actually fire related. If you look at number of calls per year, the overwhelming majority of calls in fire service are actually medical calls. And so these can vary from minor medical calls to the more serious issues such as fatal vehicle accidents or suicides, those types of things. And I'm telling you, through working with these individuals and hearing the stories and the calls that they're responding to, frankly, a lot of them are hard to hear, extremely traumatic. And these are things that these individuals are exposed to on a regular basis, and they don't have appropriate coping mechanisms. So think about that as an added stressor on a regular basis that, you go to bed at 9 or 10 o'clock at night, and at 12 o'clock, you have a structural fire that you have to respond to. You wake up and now you've got an apartment complex or a house that was on fire. You've got a family of 5, 3 made it out. You have to go in and find the remaining 2 victims. And sometimes you're successful and sometimes you're not. Regardless, you have to go home and deal with that on a regular basis. And it's frankly extremely traumatic. So the speculation in the literature has been that the combination of multiple stressors in this occupation is contributing to increased heart disease risk because it causes increased inflammation and oxidative stress in the body. I'm emphasizing that word speculation, but it is clear, though, that there is an elevated prevalence of heart disease in firefighters. In fact, it's about 50% of all deaths in this occupation are attributed to some sort of adverse cardiovascular event, primarily heart attack and stroke. So again, the big speculation in the literature is that it's due to these stressors. Why is that? It is known that when you're exposed to stressors, especially when the stress is excessive, chronic, and intense, it causes the stress hormone response in the body, increased epinephrine, norepinephrine, or adrenaline, and cortisol. And those factors give you increased inflammation and oxidative stress. I'll briefly talk about that. It is well known that those 2 factors certainly increase your risk for cardiovascular disease. It's also true that an increase in physical activity, regular exercise, attenuates that response. It's also true that factors like poor dietary habits and obesity will exacerbate that response as well. But there's really lacking evidence in firefighters. What is oxidative stress? I wanted to just take a brief moment to talk about that because not everyone in the room is going to be familiar with what this is. I looked at the RSVP list. I know that there are a handful of you that know it really well, but if you've never heard of oxidative stress, most likely you've heard of free radicals. And when I ask people, have you heard of free radicals? Most people say, yeah, I've heard like they're bad for you. They can cause premature aging and cancer risk, those types of things. Those statements would be true, but oxidative stress is when your body produces excessive amounts of free radicals. When this happens, it's known to increase your risk for developing chronic diseases. Now, everybody in the room has actually visually seen the effects of oxidative stress. If you have seen fruits that have spoiled or gone rotten, or metals that have rusted, those are all visual examples of oxidative stress. The same thing can happen inside the body when your body is exposed to excessive amounts of free radicals. The same progressive breakdown can occur to your cells, to your DNA, to enzymes, important molecules that you need for normal physiological function. What is the implication? Most, if not all, chronic diseases, many chronic diseases are linked to, and in some cases, there's enough evidence to say that they're caused by increased oxidative stress. There's actually quite a bit of evidence for diabetes, insulin-resistant diabetes, cardiovascular disease, Alzheimer's disease. The list is really pretty extensive. So what we have done in our lab in the last several years is we've introduced some nutritional interventions in human subjects. We've looked at moderate carbohydrate restriction, intermittent fasting. We've looked at dietary antioxidants, such as astaxanthin, curcumin. These are antioxidants that can be used to mitigate some of those responses or some of those effects. Among firefighters, we've published a number of studies dealing with time-restricted eating, which is a form of intermittent fasting, and a moderate carbohydrate restriction, not an extreme carbohydrate restriction like what you would see with a ketogenic diet. But in summary, through a handful of studies, we've actually found in firefighters improvements to several markers of occupational performance, reductions to markers of inflammation, oxidative stress, and improvements to cardiovascular disease risk profiles as well. However, there's actually more evidence that regular exercise is the best thing that you can do to increase your body's natural production of antioxidants to stop that oxidative stress. There's overwhelming evidence that people who are more trained and exercise on a regular basis, they develop a stronger defense mechanism to defend against those free radicals and stop some of that damage. In fact, we did a study once. I really didn't even have to put this in here, but I think it's interesting, especially because Thanksgiving is coming up. We showed that even one acute workout can reduce some of the adverse effects you get from a very high calorie meal. So what is the implication of this? Again, Thanksgiving's coming up. If you have an event like that or a celebratory dinner, you're going out, you're going to get your steak, baked potato, margarita, whatever you're getting. It would benefit you to do even one workout the day before. That's been shown in our lab. So now getting into the work that I'm doing in collaboration with THRC, we're trying to answer the question of, is regular exercise in firefighters cardioprotective? What is the impact of regular exercise? So in our most recent study, data are currently in press. We looked at common metrics of physical fitness, cardiorespiratory fitness, body composition, muscular strength, muscular endurance. And we measured those in relation to a number of blood markers of inflammation, oxidative stress, and heart disease risk. These data are in press. And what we just found is we took a group of about 50 firefighters. We categorized them into two groups based on their cardiorespiratory fitness. So we had one group that was HF, high fit, and one group that was LF, low fit. And what we looked at on the left here is insulin and HOMA-IR. These two markers are indicators of insulin resistance. You can think of that as insulin resistance. HOMA-IR is a homeostatic model assessment for insulin resistance. Those are like diabetes risk. You could think of those as an indicator for type 2 diabetes. Both of those significantly lower in high fit firefighters. We also looked at C-reactive protein, which is a very common marker of inflammation and heart disease risk, as well as AOPP, advanced oxidative protein products. That is just a marker of oxidative stress, and it plays a role in atherosclerosis and heart disease. Both of those significantly lower in high fit firefighters as well. The larger study that we did that's also in press, we took a larger sample of firefighters, 98, and we ran regression models, OLS regression models, and looked at major predictors of those previously mentioned biomarkers of heart disease risk. And we found that the biggest predictors were high waist circumference, low cardiorespiratory fitness, and high blood triglyceride levels. And so this work's been shown in other populations, but when you start studying it in this specific population, it hits home to them. They get the message. It's more meaningful to them. And so it underscores the importance of maintaining high cardiorespiratory fitness in the firefighter community. And so now we're trying to, going back to this image, kind of bridge this gap, and this is what this current research is doing. Now we're trying to answer the question of, are those stress biomarkers also significantly related to those additional markers? So as of right now, we're looking at a number of markers of stress found in saliva and blood, and we're trying to correlate those to the markers of heart disease risk as well. One final point that I wanted to close on, I think it's a message that's important. This is a paper, the title is, who are we publishing for? Are we doing it for ourselves or for others? What are we doing this work for? We're all doing research. Are we doing it to get tenure and promotion? Are we doing it just to increase our numbers? I think it's just very motivational and just inspiring to just remember what we're doing this work for. We're doing this work to make an impact. And I've been lucky in my career to be very well supported from groups that allow me to do this type of research. And so I'm lucky that I feel like my work is at least making some sort of an impact. And I think it's a good message for not only faculty, but also graduate and undergraduate students that are involved in research too. Just something to keep in mind. Have to always give thanks to my collaborators. Big collaborations and support from the THRC group. Thanks again for putting this on, Jessica, Melinda, Abby. You guys are awesome to work with. Appreciate it. I also collaborate with the Alert Center, and I have a large group that I work with at Texas A&M, the Kaufman's Institute for Sports Medicine, and they're doing a lot of the firefighter work with me. So huge thanks. I appreciate it. That's what I've got for you. Thank you for your time. Yeah.
So thank you, Translational Health Center, giving me this opportunity to present part of my research of interest, and also have no interview. And then Matt just now presented a very wonderful kind of topic. Now I follow that. My topic actually focuses on the role of nutrition. So I'm the assistant professor from food and the nutrition and foods program. So my name is Jacky Zhu, or you can call me Jacky there. So when it comes to this topic, actually, because of the COVID, so we have a lot of information about nutrition. What kind of nutrients do you need to test, right? So for this topic, there's no conflict of interest when it comes to the specific nutrients we're talking about. All right, so our immune system actually is a very dynamic system. So I'm gonna talk each of them right away. I'm just kidding. All right, okay. Yeah, so it's a very dynamic and a complex system here. So actually, immune system can actually provide a good defense for us from infection. Generally speaking, our immune system consists of innate immunity and acquired immunity. So innate immunity just like provide a general defense, such as your skin, your mucosa, and also some neutral killer cells who behave just like a warrior to fight against all the kind of pathogens into your body. But acquired immunity actually focuses more on specific target. Just like when the specific virus enters your body, so the acquired immunity actually tries to show up to target those specific virus bacteria with the antibody generated there. Okay, so that's how it works with our immune system. Again, healthy immune system is vital for keeping us healthy, especially during the COVID pandemic kind of situation. All right, so people have become very interested in about what factors impact our immune system. So actually there are many, just as Matt mentioned, stress is one, and also your genes, your medication status there. And also today I focus more on the nutrition, the role of the nutrition. Okay, so actually we have macronutrients and micronutrients. Macronutrients such as protein, fat, and also carbohydrate. So actually they serve as a kind of very important materials for our kind of physical areas. Okay, and also micronutrients such as vitamins, minerals, vitamin A, vitamin C, minerals like zinc, selenium. So actually they play more role as regulating our immune response when it comes to the infection there. So again, they coordinate, work together, just like the components in the military force. They work together and it's to fight against those kind of pathogens. So what about the malnutrition status? So when we talk about malnutrition, we think about obesity, right? And also metabolic water experience. So actually the latest CDC data shows that those with actually malcondition, such as diabetes, such as obesity, actually they have a way higher chance of having the COVID, especially severity, showing as a hospitalization. So after infection there, as you can show here. Okay, so What about micronutrients role? So actually the data from the Europe shows this one just demonstrate the data about the 10 critical micronutrients. So as you can see, the orange line demonstrate COVID incident rate, and also the gray line shows as a kind of death rate. So as you can see, so as those kind of intake of vitamins going high, and both incident rate and the death rate goes low. And also the same applies to micronutrients, minerals such as zinc and selenium as well. So which give us some kind of insight of those importance of micronutrients. However, this observational study. So as a researcher, everybody here may be aware of that. We cannot infer the causal relationship, right? So is there any RCT or randomized clinical trials to prove it? The answer is yes, but it's very limited. So this study actually is conducted among those COVID patients, and then the researchers actually incorporate nutrition support system, which actually consists of essential minerals, vitamins, and also omega-3 into the general medical treatment there. And then it shows that this nutrition support system can actually increase the survival and the decrease in mortality among those COVID severe patients there. Okay, so that just brings about some concern, because a lot of time, like a medium, they would like to promote this information because they want to sell their products here. Okay, so here's a kind of neat image that, okay, should I buy more supplements here? Actually, as a nutrition professional medicine researcher, we still speak highly of dietary pattern, like what kind of a diet you take. Okay, so is there any evidence coming from the whole food intake or dietary pattern? Yes, so this study actually was conducted in UK and the US, including large amount of cohort. And then the study found out that higher healthy plant-based diet here, healthy plant-based diet intake higher is associated with a lower rate, risk and the severity of COVID. And also the study also found a very interesting kind of results that this association become even more obvious among those populations living in the area with high social economic deprivation. So with that said, so social factors probably also play a role in this nutrition and the disease relation there. Okay, so this is a healthy plant-based diet. Why we promote that instead of like a nutrient supplementation? Because this plant-based diet also can introduce bioactives or phytochemicals in it, which actually has a role of anti-inflammation and also enhance your kind of immunity function as well. So that's why we promote the whole food intake. Is there any other diet pattern which can also give us the benefit of lowering our infection rate? Yes. So this and this is another very large prospective cohort study conducted in US. And then it shows that the higher the adherence to Mediterranean diet is inversely associated with like a risk of COVID and also severity of COVID there. Okay, so so when it comes to Mediterranean diet, so we talk about a diet pattern. What are the issues we need to keep in mind? So actually, so Mediterranean diet, the very famous feature is it includes like seafood recommendation. So Jessica, would you tell me like which salmon do you like?
I mean, they both look delicious.
Yes, especially in Texas. Because that's actually my first kind of impression of Texas when it comes to food. So many barbecue food. Right. Actually, this is the area not many kind of researchers pay attention to. Actually, cooking really matters. So those kind of those kind of vitamins and also omega-3, they're very, very fragile to high temperature. So if foods experiencing the high temperature, actually, eventually you may not enjoy the benefit of taking them. So I would like to raise this concern as well, so that we can translate that to the health promotion as well. But of course, this is the call of the research in this field as well. All right, so sometimes when we're doing nutrition research, we feel frustrated because one day, one study saying that it works, the other day, the other study saying that it didn't work there, right? Even though they're very high quality randomized clinical trials incorporating vitamin D into their medical condition, but they're totally different results. So as a nutrition researcher, I always think about it. So what's the problem with that? Number one, the researchers conducting research in different areas. Definitely the participants are different. Okay, one reason contributing to it, just like because they may have different metabolic status there, right? But also it applies to the public dietary recommendation as well. So traditionally, our dietary recommendation is just like one size fits all. So they just tell you, okay, how much omega-3 you need to have, how much folic acid you need to have, right? They set a similar standard for everyone. But the reality is, even though you have this same amount of intake, you may have different response for the optimal health there. So which actually give us some kind of thought about, okay, I may need less or I may need more so that I can enjoy the more benefit of taking it, right? In reality, is that the case? Yes, somebody like can crazily become like a skinny if they have a hot pot every day. But somebody can crazily become like a easily gaining weight, even like they have more like a water intake, whatever. But with that said, just like that, it gives us some kind of thought about the research in nutrition. So what kind of gives up those kind of noise? Okay, actually, I'm focused on genetic variation because as we know, every nutrient is intake. So they need to go through absorption, digestion, absorption, and being processed by a lot of enzymes. Okay, so who decide the enzyme function? So actually our genes, the genes including protein and eventually decide the enzyme function here. So actually your genes may give you different benefit of processing the nutrients you take, right? For those who don't have the genetic variation encoding the key enzyme, so they can easily let the nutrients enter the body and make it available, being used as a material, as a regulator for your health. But however, those who carry the genetic variation may probably have to think about it, whether I need more so that I can enjoy the same benefit of the bioavailability of this kind of essential nutrients there. So with that said, is it supported in the when it comes to the relationship between nutrition and immunity? Yes. So actually, this study also shows that even given those, even those who have the recommended daily amount of different nutrients, essential nutrients intake, actually, if they carry the genetic variation, so that genetic variation actually can influence the bioavailability of different essential nutrients there. So which gives us some idea about, okay, we need to generate some individualized dietary guideline for different people with different genetic background so that it can let them better enjoy the food intake or nutrients intake there. So, so actually, it's great to see that NIH actually make this announcement. So for the following 10 years, they focus on precision nutrition. Part of the strategic plan involves personalized nutrition. So as a medical background kind of a researcher combined with nutrition research as well, so I'm interested in how this nutrient diet, how this nutrient gene interaction can influence the disease such as metabolic syndrome. So I proposed this study. And also, I would like to see, number one, whether this nutrient gene interaction will influence different risk of disease preference. And also, second, I want to use this preliminary data, which we call the association, to see whether this pattern differ among different populations, such as Black, white, and especially Hispanic Latinos, which actually haven't been given too much attention when it comes to this research. So this is the framework of this research. And actually, me and also my collaborators were at this stage. We try to generate this data to set up the association, and then we would like to collaborate with those who are specialists in AI technology to generate the algorithm so that they can create a kind of predictive models. So especially predictive models for different populations with different ethnicities, so that eventually in the future that can be available something like app on your cell phone or on some device, and the health professionals can rely that to put in your age, put in your health status or health biomarker index there, and then put in your genes information there, and eventually you will be given the very personalized advice of how much nutrients, essential nutrients I need. So that people can enjoy the benefit of this nutrition research in practice. And with that said, this study is going to contribute to the promotion of resilience among the population there. Okay, that's all. Thank you very much.
Yeah, I just have a quick question. I'm curious about the intent for Matt, the intensity of the exercise. What intensity level? What did you find?
So for the firefighter work that we did, we divided them into categories based on VO2 max. And so the protocol that we used was called the Bruce treadmill protocol. And basically what the firefighters would do is they come in each year and they do a graded exercise test, like a stress test. So they go until max, and we take their following this Bruce protocol. It's a specialized protocol. It starts at 10% incline, 2.7 miles per hour. It's a very common protocol. Every 3 minutes it increases the speed and grade. We just get their time to completion. They go until they can't go anymore, and we get the time to completion, plug it into a formula which is called the Foster equation, and we can get their predicted VO2 max. You could also do it with a metabolic analyzer, but we didn't do any sort of intervention looking at different intensities. What we did for those studies was let's find their VO2 max, which reflects their aerobic capacity and reflects their overall cardiometabolic health. And we just divide them into categories based on that. And so basically what that is showing is if you're more fit, if you're exercising on a regular basis, it's a preventative factor for heart disease risk.
Okay, so I see. So for generalizing the general population, just more fit is
Yes, exactly.
better for
Exactly.
reducing stress.
Exactly. For the Thanksgiving Day example that I gave,
Yeah.
that one was actually, there's been a line of studies showing endurance exercise, pretty moderate to high, endurance exercise. Our study was the first one that did resistance training only. It was actually a weightlifting workout, and it was a pretty high intensity. It took about an hour. But there's other studies that showed that moderate to high intensity endurance exercise, cardiovascular exercise, there's quite a bit of evidence for that. Yeah. All right. Yes. Go ahead. Shri.
Just a couple of, I guess, questions, maybe comments. Listening to this side, on the nutrition side, have you looked at incorporating into your research genetics profiles of firemen and or others to kind of correlate what's happening with that?
Yeah, perfect. Jackie and I have been talking about
Yes.
that. We're trying to work that out to get that collaboration going. Absolutely.
And then the CRP you're looking at, so we look at that all the time in the medical laboratory. And I'm sure you're aware that's a pretty broad inflammatory marker. It gets a lot of criticism in the medical field. Do you have others that you're peeking at, or?
Yes, a lot. So yes. Well, one of the first studies that we did, we had to cast a big net, and we included like about 28 cytokines. With those, we looked at adiponectin, bistatin, resistant, all the interleukins. We also look at the traditional markers of heart disease, like the cholesterol, HDL, and LDL-C. And so what I reported today were the things that hit biggest. So, question.
Yeah, well, Rodney asked part of my question, but the other part, Jack, you were talking about like personalized medicine, you were talking about personalized diet, I guess.
Personalized nutrition.
Personalized
Yes.
nutrition,
Yeah,
sorry.
yeah.
So in addition to exercise, obviously nutrition is something a marker for stress as well, I would think. I mean, I'm a physician. So, doing the genetics thing is, I would say, more challenging
Yes.
than probably linking personalized nutrition to a firefighter's lifestyle. So I don't know whether you guys have given thought to that.
Yes, yeah, Matt, you want to address that?
Yeah, so I've been thinking about how to expand this to a larger population in the whole state of Texas. One of the things that I've been wanting to do is, we talked about it, and I've always wanted to have a mobile lab so we can go to different departments and have a larger outreach. But I also have been thinking about incorporating nutritional screening, so collaborating with individuals in nutrition. That's on the plate, absolutely, just because there's minimal data looking at nutritional intake in this population, very minimal. Even less data doing nutritional interventions.
And nutrition and stress kind of
Yeah.
relation.
Absolutely, because they're stressed. How are they coping? They're coping with alcohol, nicotine, and poor dietary habits, because they don't have consistent. They don't have consistent anything. They don't have consistent sleep or feeding patterns. So you have to eat on the go and eat. You also eat what they have at the station and the culture of the station.
It's interesting, because when you talk about firemen, it makes me think about healthcare, like right now, that's the same kind of stuff. Going on.
Yeah.
There's no time for eating, there's no time for rest, there's no time for anything. It's getting worse, extra shifts, a lot of work, a lot of bad.
Yes, and then the shift work too is something that throw the circadian all off. Yes, Melinda.
So for me, I don't know a lot about the specifics of their research, but when they talked about it to me, I found it incredibly compelling. And so that was sort of the first sign that I wanted to know more. And then, working with you, I also see that the obvious, you're both scholars. I mean, you do rigorous research, and that's what we want to build. But you also have some obvious implications for the public, and sharing this in tech transfer and IT and all these things that we can develop, these systems that were integrated into your medical record that the doctor would have, or that firefighters could have in their firehouse to assess whether they really want to eat that big enough cheeseburger, whatever. And so that to me is tremendous. But I wanted to ask you, and I'm totally putting you on the spot. I know that you both have other collaborators, you both are seeking funding and have whatever, but what is it about the faculty fellows experience that is unique for you?
Well, first of all, I mean, like you said at the beginning, we didn't even know each other.
Yeah.
And so when I first met him at our initial meeting, we sat together and we're like, we need to tour each other's labs.
Right.
And we need to figure out how to connect, because we can absolutely integrate our work to make a larger impact. So that's been, and the whole THRC, the whole THRC community, that's what it's been. It's been really fascinating, because it's a great opportunity to bring people of different disciplines together. You meet people. I looked at the RSVP list and I wanted to see who the audience was. So I know there are people in here that do very similar work that I would never even have connected with if we don't have an event like this. Wanted to add to that.
Yeah, I totally agree. And also, this Translational Health Center just created a platform for us to get to know each other, especially now. It's the highly of like a multi-disciplinary collaboration. I feel like that's very, very important in the field of health there. So thanks to this organization, we get to know people doing research in exercise, nutrition, and also we have the researchers in the campus doing something like bioinformatics. So this is a great kind of place for us to collaborate. And also, I would like to extend my kind of a vision or those kind of thing to our colleagues here. So we have like very diverse nutrition faculty here. So actually, since I joined this Translational Health Center, and I try to promote them to participate in that as well. That's why they're here. So we have Mona, we're doing nutrition and cancer. We have Guy doing nutrition and microbiota. We have Cassandra doing nutrition and public health and also disparity. So actually, I mean, it's not only about us. It's about we have this organization, and then this organization promotes this spirit, promote this vision, so that we can let more people we share their nutrition with interest and the collaboration. And what's funny is that since I joined it, I started to search the expert, something like, I didn't realize that it's there. So actually Texas is such a big university. So actually we have very diverse faculty members. And even the other day I searched like the geography department and I found,
So I was going to say,
Yeah.
I do
So
have a
right-
question, but also follow that.
yes, I searched that and I didn't notice that some scientists doing something like air pollution.
I was going to, my question was related to
Yeah,
that.
so I feel this also- you know, yeah, next
Yeah.
week's organization, I feel like that gives us more opportunity to get to know each other and then gives us more potential to collaborate.
Thank you. But can I ask my question? It's also follow up with this discussion about interdisciplinary collaboration stuff. First of all, I'm sorry, Matt, I had a previous meeting, dismissed almost all of your talk. So I'm going to find an opportunity to learn.
We'll record it.
Okay. Yeah, well, I heard the whole talk, Jacky's talk, really enjoying that. I like the concept of precision nutrition, right? So my question is, it's related to what I do and also what we do in geography and environmental studies. So I understand, I assume that's mostly about individual precision nutrition and also related to biology and gene, right? So how do you incorporate things, factors related to behavior and related to environment?
Okay.
Because we're always environmental exposure, air pollution, and also build environmental exposure. And I do those, you know, how facilities they're outdoor, indoor, is that going to promote active lifestyle or not? And I do food desert research as well.
Yeah.
So individual behavior or partially related behavior and also environment, social or natural environment, right? And stressors and stimulus. And I'm sure you will be able to incorporate those into your precision nutrition model studies.
Yeah, of course, like as you can see, first of all, in my models there, you can see I incorporate social demographic factors into it. Because as an individual, we live in the real world. We're not isolated, right? So we have to think about those compounding factors. Okay, and also from a biological point of view, actually, when we face the stress and when we face the air pollutants in the air, so actually, it doesn't mean that we generate disease. However, our body has a defense system, which is similar to immunity as well, just like we detoxify those toxins or pollutants entering our body. And one mechanism is about methylation. So thankfully, my interest in nutrients is called methyl donor nutrients there. So actually, one mechanism related to nutrition and air pollution is demethylation. So actually, when we have like bad air coming in our body or pollutes there, so actually our body processes it through demethylation. So, but who provide the methyl groups here? Nutrients like folate, B12, B6, choline, betaine. So actually, that's my field as well. So I feel like, according to your question, that could be a potentially quick response to the potential collaboration between air pollution and the nutrition there.
And where you're getting at the personalized component, you can look at how, when someone has this exposure to some environmental contamination, you could look at the genetic SNPs of individuals who respond differently,
Correct.
perhaps how their response mechanism, there could be genetic variation. So you can likely predict who might be at greater risk to that potential exposure.
Yes.
And then you're combining that with systems biology with the nutrition component. Put those two together and you can figure out who might have exacerbation of a particular condition of both environmental exposure and food.
So, yes, good point.
Thank you.
Because food actually is one of the environmental factors.
Right, I'd like to follow up with you on those, because generally geography, environmental study, we look at the collective level, but actually health effect, a lot of those are really individual level, and how, and environmental exposure, we measure air quality, air pollution are also collective level. It's not about, but really what impact me is that I spend so much time here and then I spend so much time in my office. Really, this is how this impact my kind of exposure to air pollutant. And then, so really, if we can collaborate on that, that's going to be great.
Yeah, I think it definitely.
Community versus
Yes.
individual. Yeah,
Right. Yeah, I appreciate that.
yeah, thank you.
Matt, you mentioned something about a mobile lab But one of the things that COVID really brought about was the widespread acceptance and use of rapid at-home diagnostic tests, as well as things even for genetic testing and maybe those polymorphisms or methylation patterns, being able to collect a sample at home, mail it off, and get those diagnostics
Yeah.
coming back. Have either of you thought about how you could integrate that diagnostic component for somebody, maybe that's participating in your study, but eventually you want this to be widespread, that others can be able to monitor long-term stress responses, stress markers, and or that's that first component of your personalized nutrition is the diagnostics piece. Have either of you thought about that? How to make that more readily available?
No, but when you were talking, I was like, whoa, that's a really interesting thing. I started thinking about, you can self-collect a saliva sample, something like that can be done. So just, a bunch of light bulbs are going off when you ask that question. It's really interesting. I never thought about that because traditionally we think about blood, so that'd be hard to do. But
Saliva is much better.
Yeah, so it's certainly possible. It's a really good idea.
And then my personality will say, be very careful, because quality control.
Yeah.
That's what I'm saying.
So
Yeah, that's obvious. Yeah,
so
because-
much bad.
Yeah,
happening.
right.
I can't even give it to
Right.
you. Using nasal swabs down the throat.
Uh-huh.
It's crazy stuff. The results come out.
Yeah, logistics.
But certainly, definitely.
Yeah, of course.
In a way that's gonna work.
Yeah. Like shared data collection firehouse, everybody
Yeah.
has their thing and you get on Zoom with them and you go, okay, now everybody
Yes.
fit,
It's
and
definitely-
that's a little bit longer.
People are going to do what they
They
do,
are.
but yeah, you try to engineer
My
them out
chest
that
has
as
been
much as
sitting
you
on the
possibly can.
dashboard of my truck for 7 months at
Yeah.
180.
Perfect. Still good.
It's gonna be
Sam.
good.
Yeah, definitely.
Stuff like that.
I work in diagnostics and lateral flow immunoassays and strip tests. I've done salivary diagnostics and things like that before. So I'd be happy to kind of continue conversations as well as a number of companies.
One more question, anybody? First, I want to say I love both talks. Thank you so much. I studied some of the topics and I learned so much more than I already knew. So it's really fascinating. And I was thinking about, and before I get to my question, glad you mentioned alcohol. I'd love to go off on another tangent of how that relates. Just asking for a friend, of course. But my question is about the translational nature of the work. And of course, that's what the center is about. And talked about that in terms of not just publishing for academics and apps and things of that sort, but in the long term before that, what are you doing, or do you have ideas about how do you get this information to the public in a really expedient way? Like if I learned something today, I can only imagine how helpful this would be to get it through community education or practitioners in the center. I know this is the whole point of the center is translating that. So I really struggle with how to do applied work and then really get it out there. Do you have ideas or strategies?
We're looking at setting up webinars and town halls this spring for major firefighter departments.
Okay.
Share those findings. That would be one thing that we're looking at doing and targeting major departments. But
It's happening.
yeah, I think I'm already in the books.
Okay.
Yeah.
So I want to jump on that. There are pieces that this will never be a group where we put you making write a grant together because it has to be organic. You have to have the passion and fit and whatever. But I have from a lot of experience from health scholarships to see these organic relationships that are amazing, like these two and others. So the transfer can often come when you have somebody that really has a passion for ed tech or somebody that has computer science that knows how to develop apps, or that those relationships can happen. And that's also where we're going to have our best bets for funding off it, because it's novel and it's a ways to do things in ways that others are not, that don't talk to each other. So that can be our secret sauce in getting things translated to the public. But our center, and Jessica specifically, everybody that's a fellow has to do translation work. Like there's so this is, we want to share it on our community campus. We do want them to do academic research, but that is not our mission. We do want them to work toward getting grants, but we don't require it. We require them to do things that are translational and then work with us to do something translational during that year.
plug for writing articles for the conversation.
Yeah.
Yeah, so
And Rodney. all of
yeah,
it,
so
right?
it's the same, has a partnership, so especially for faculty who haven't had a chance, if you have an article that's in press or that's been accepted, you can pitch your idea for a story to highlight findings from your work, especially with real world implications for people, you know, the community, for groups of practitioners or other researchers. And usually it's pretty fast, like if it gets accepted, 2 to 3 weeks, the editors will teach you how to write in a way that highlights your work and is also really interesting to the public. I've done it a couple times and it was such a positive experience. I know I've encouraged people and everyone's busy, so this may be my chance to say writing for the conversation is a great way to get your work out to a much larger audience. And you also will really, like, in my opinion, level up your writing and communication skills.
Yeah, I totally echo everything you said. It's transformed my own personal work. And I mean, you guys both y'all are ready to go for the conversation if you haven't done that yet. It's very quick turnaround. And I would advocate, I've kind of talked about this with Melinda, treat that I wish Texas State would also consider an opportunity to build, maybe it comes through this center, a way to train and talk faculty to interview and to be out there, science communicating in a way that's impactful. I've kind of learned that over the last 4 years during the pandemic out of on-the-job training. And it's actually what I want to do now going forward, is kind of do more of that with what I do and with other people. So, I mean, I'll always be, you know, ready for that journal article, but usually just your population is reading it. Has been my experience. So you really need to find a way to push it out. Right.
We have some resources, this is the person that I'm on some working with journalists. PR professor, working with journalists. He used to be the spokesperson for the Air Force. So we're working with journalists and knowing how to tell scientific stories. So a little bit of resources there. The marketing department is really the key point of conversation. So we can't really do that directly, but we can indirectly help. Heather Peterman is very excellent at it, by the way. We would go through university marketing people. And then the other thing is next year, we're opening a big newsroom, a big newsroom that's in partnership with our journalism school. And so it is going to be an opportunity to really amplify all of our research and research with our partners at other universities, which is something we should use to help. You know, it's like a relationship bank. You got to come in, you can say, hey, we can help you get coverage on your research session with me or whatever. So we're thinking in this direction. Rodney is great at it already, and here others, but the conversation, Catherine, and we have some resources, but we're building that direction.
One last piece, everything Melinda said, and then be willing to actually let your administrative kind of speaking pieces know that you're willing to be a subject matter expert. Because when you do that, they have the connections to the journalists and international outlets and things like that. That's hard to do on your own, in my experience. I mean, it might have some groundbreaking research that's published, but otherwise, again, nobody really knows that unless you have help to get there. So let them know. They'll put you in the newsroom contact list, and then be careful, because then your life becomes, you know, you start doing a lot of interviews and things like that. But it's cool. It's an interesting route.
Well, I want to thank y'all. That was amazing.
Make sure when you do not sign in, make sure you sign in.
So right now. Right now.
Thank you, Sarah.
Yeah. Can you see it from your face?